only a reminder that we're getting closer to the first official day of winter. Your skin drying out in this colder weather also probably does the job. And Fox 28's Mario Gonzalez joins us live from Dermacenter MD in Elkhart. And Mario, when we're dealing with our dry skin, there's still more we need to think about to keep it healthy.
Yeah, Allison, and we think about the dry skin now because of the weather we're seeing and the winter season not too far away from officially being here. But as you mentioned, there are some other health risks that we can run when it comes to our skin. And to talk about a few of those, we're joined by Dr. Roger Moore. So Dr. Moore, let's start with frostbite. That is something that's going to be on people's minds during the winter season. What are, I guess, some of the symptoms, some signs that might be occurring?
With frostbite, it actually occurs because your skin is not getting good blood flow, and the skin actually gets so cold that you'll get numbness, burning, and tingling in the skin. But ultimately, you'll end up with no sensation. So if you start down that path of having some symptoms of the numbness, tingling, or burning, that's probably letting you know that you need to be a little bit warmer and cover up a little bit better. If you get numbness, you need to get in and warm that skin back up.
And on top of frostbite, something else that I think people are kind of starting to become, I guess, aware of is skin cancer, and I guess it's the alarming rate that it's growing at.
Some people view skin cancer as occurring in epidemic proportions right now. When we look at breast cancer and colon cancer, there's usually about 300,000 cases per year. With skin cancer, there's about 3 to 4 million cases per year diagnosed here in the U.S. alone.
And let's just talk about, we've got some examples of what skin cancer may look like, where it's not maybe it might seem as something as a little opening kind of, but it could be much more serious than that.
Right. A lot of people think that skin cancer is going to be an open sore that occurs on the skin. Well, what we don't realize is that whenever it first starts, skin cancer can actually look like a rash that simply won't go away, or it can be a pink or raised bump that almost looks like a mole or even an acne-like bump. So if you're a person who doesn't normally get acne and you get a new bump and it won't go away, you probably should have it looked at. We tell people if you have a new bump that lasts more than 2 to 4 weeks, you ought to come in and get it evaluated.
And when we talk about skin cancer and kind of wearing that protective sunscreen, I think everyone probably just generally thinks of the summer months when the sun is nice, strong and bright, but that actually shouldn't be the only times we wear it.
That's exactly right, Mario. With the sun, they claim that 85% of the sun that you get, or the sun damage you get over the course of your lifetime, occurs from what's termed incidental sun, which is that sun you get going to and from the car to the grocery store to work. A lot of times it's better to learn to protect your skin 365 days a year. Many of the facial moisturizers will actually have sunscreen ingredients in them. It will say so on the box or on the front of the lotion or cream. And ideally you want to look at something that has titanium dioxide, zinc oxide, or Parsol 1789 to give you a better quality protection with your lotion or sunscreen.
Well, Dr. Moore, thanks for joining us this morning. And again, plenty of ways to protect that skin, especially during these colder months. And again, some of those things include using that cream over the lotion, kind of, turning down the temperature in that shower. And again, when it comes to drying yourself, maybe dab and not completely, dry yourself to the point where you're kind of scraping off some of that skin. It's not going to like that, and then you can avoid all that itchy burns and a few of those cracks. Allison, back